Hello.
I'm Dr. Kelsey Camille from Premier Health Chiropractic in Coon Rapids. And over here we got Dr. Brian Camille from Premier Health of our Golden Valley office.
So today we're going to be covering another piece for upper back and neck work. The last video that we did was on trapezius, which is a big broad tissue here through the shoulder. Today we're going to be teaching levator scapula, which is probably, man, if we have, say we have 10 patients that come in with upper back and neck pain, would you say probably half, if not more, have this as an issue?
Yeah, it's our yes and no muscle. It's this guy.
Yeah, and as humans work, particularly with how we're operating as a society, doing more of the desk thing, as we come more forward, it's more pressure on the upper back and neck. So simple physics, it's easier to hold a bowling ball here than it is out here. So levator gets put under a lot of pressure. We're going to teach how to do a little bit of muscle work on this, and it's a very simple thing to do. And when we do this kind of muscle work, it's great for just getting inflammation down, and it's free. Anything you can do right now that's free for healthcare, you should try it. So we're going to do a little bit of work. Kelsey, I'm going to please have you face the other direction. So as we go through this, this one can be a little bit tricky for folks when it comes to actually finding where the tissue is to work. So how we operate with it. First, we want to find where the shoulder blade is, and this can be easy to find with people, and this can be really hard to find with people depending on how thick the tissue is. So the way that I find is I go across the top of the shoulder, I can feel the top of the blade, and you can see where it curves and then it comes down. Now this what's called the superior medial angle, or just kind of like this little notch or the little curve here at the top of the shoulder blade, that's what we're looking for. Because levator scapula attaches from here, comes down, and then attaches right here at this tissue. Now, if you have trouble finding it, there's an easy way to kind of make it more pronounced. Kelsey, can we take your arm and go behind your back and see there? Now we can see it actually popped out. You can see it super clearly up and around. That's an easy way to find it. So I'm going to have her take her arm, go all the way back around. So once we have found that tissue, once we find where that little point is to where the scapula starts to turn down, you're going to feel underneath that tissue and you're going to find a cord, and it's going to be pretty pronounced in most people. Now, if you can't feel it right away, close your eyes and try to feel the tissue sliding back and forth under your fingers, and you will notice that cord. You're feeling something that's under multiple layers of tissue, so sometimes it can be hard to find. But if you can just kind of close your eyes and if you can move back and forth, it should be a little bit more pronounced for you. So how we work on this is pretty simple. Now, Kelsey has a role in this. I'm going to have a role in this. So what she has to do, she's going to start by looking all the way down to the floor, and then she's going to look all the way up to the ceiling nice and slow. Excellent speed. So what she's doing is, as she goes through her range of motion, we create a contact point that then pulls the tissue underneath the pressure we're putting on it. So basically, we're just doing muscle work with using our own body weight. The second part of her job is to breathe. So she'll look all the way down, take a deep breath, exhale out, looking up, nice and slow, breathing normally. Till we get to the top, we take a deep breath in and let it out. Perfect. This just makes sure that we're still taking in breath as we go through the movement, because people like to hold their breath during this stuff. The last part of it is Kelsey is supposed to let us know what is an appropriate amount of pressure. The way that she likes to word it is, hurts so good. If it hurts so good, we're in a good place. If it just straight up hurts, we've exceeded that and we need to back off on pressure. If we get into the hurt, the problem is the patient's going to resist what we're doing and we don't get anything done. So I'm going to have her look all the way down. I'm going to find that cord, and I'm just going to take a thumb contact, put one thumb on top of the other, and then I'm just going to lean my body weight in. It does not take a lot of pressure to make it so that the patient responds to it. So pressure goes on. Kelsey, take a deep breath, exhale, and then go all the way up nice and slow, all the way up. Beautiful. Get to the top, take a deep breath, and exhale it out. Excellent. How was that for pressure?
Perfect.
Okay, let's do it one more time. Looking all the way down. Deep breath in and out. Coming all the way up, all the way up, all the way up. At the top, we take a deep breath and out. Beautiful. Now, anytime that we're doing this kind of muscle work, we're always going to do it in sets of 3. Or actually, should I say 3 reps of it. So we do the right side 3 times, and then once that's done, we go to, or the left side 3 times, we go to the right side and we do 3 times as well. And what that's going to do is just kind of free up a little bit of that upper back and neck tissue. As always, whenever we're doing any of this stuff, if you're sore afterwards, icing is always a good idea. An ice cube working through the skin for about 5 minutes is great just to get it more of a deep icing, but 20 minutes on, 20 minutes off is just fine too. But anytime we can teach these things for you to be doing at home, please do them, because it's nice to have something in the skill set at home where if it's Saturday and you're sore, somebody at the house can help you out. We do teach all this stuff in our clinic, so if you want to get a little bit more of a hands-on approach, always feel free to reach out to our practices to get set up for one of the nights that we teach. We usually do this each for about one night a month. We'll bring patients in and teach it. So use this, make sure that you take your breaths, and make sure that you just try to remember that anytime that we're doing our work, we want to be up and back, because otherwise it puts a lot of pressure here. So thank you so much. Talk to you soon.